Today I'm going to tell you about whether watermelons it can cause diabetes or high blood sugar. So from today onwards, I'm going to tell you about the diet which can cause or which can increase our blood sugar. I'm starting with the raw foods like fruits and vegetables, and then going into complex foods like ice creams. And so today, is watermelon safe to health, and can it be taken for diabetic? And if a diabetic patient takes a watermelon, will the blood sugar increase? And watermelon per se can trigger diabetes or can cause high blood sugar. The watermelon is the glycemic index, anything above 50 are the foods which can cause high blood sugar. What is glycemic index? Glycemic index is when you take a food, the blood sugar goes up and stays at a high level for more than 2 hours. This is called as glycemic index. This value is found out for watermelon is 80. The gold standard for glycemic index is white bread and white rice. The value is 100. So anything that is below 20 is very safe. 20 to 40 is very good to the health. And any food that is nearer to 100, like above 70, nearer to 100, these foods cause very high blood sugar in the body. So watermelon is 80. So the glycemic index is very high. So, but the doesn't cause the blood sugar high rise or diabetes very, because not only the glycemic index, it is the glycemic load that is important. So what is glycemic load? Glycemic load is, if you take a 1 kg of watermelon, the carbonate density is only 5 grams. So the load is a glycemic load of 50, it is only around 4. If the glycemic load is above 10, these foods, they cause very high blood sugar. Example like the ice creams and the donuts and cakes, they have very glycemic load, but the glycemic index will be low. Third is, after taking a watermelon of 80 glycemic index and a glycemic load of 4, will the insulin rise? This is called an insulin index. So if the insulin index is very high, that means we are pumping more insulin to reduce the glucose. But the insulin index is very low for watermelon, whereas the insulin index for oily foods, oil-based foods, or for French fries and all are very high. Raw red meat is very high, whereas for glycemic insulin index for watermelon is very low. It is only 2. So it is very safe. It doesn't cause diabetes. So the problem is here we have to know glycemic index, we have to know glycemic load, we have to know insulin index of every food that we are eating. So I am starting from a simple raw based food, which is daily available in India, and most of the Indians consume in the next few summers. So watermelon has a glycemic load of 80, but the glycemic index of 18, but glycemic load of only 4, and insulin index of only 2. So it is very safe. It doesn't trigger diabetes. But this is only the fruit part. What about the host part? That is human being who is going to take it. The human being has a fasting blood sugar. If the fasting blood sugar is below 100, and if the fasting blood sugar is between 100 to 120, this is the pre-diabetic state, and fasting blood sugar more than 120, pure diabetic state. The amount of watermelon that is taken, a slice of watermelon that is taken, changes between these 3 patterns. Second is the insulin resistance. The insulin resistance is, once you take the food has to be distributed by the body by the insulin. This gives a signal to the tissue like the skeletal muscle and adipose tissue and liver and other tissues to absorb the glucose into, because we have taken a watermelon. This is called as insulin resistance, found out by formula fasting insulin and fasting glucose divided by 405. If it is more than 2.3, then it indicates insulin resistance. For people who are having high insulin resistance, more than 5, but HbA1c, fasting blood sugar, random blood sugar will be normal. These people, if they take the watermelon, the chance of blood sugar being high for a longer time will be high. Third is insulin sensitivity. That is, every tissue in the body has the sensitivity to accept the glucose into the body. This depends upon the insulin sensitivity factor, which is made out by fasting insulin minus fasting glucose divided by Matsuda index. This Matsuda index, if it is 4.3, is the cutoff point. Anything as it increases, the chance of getting insulin resistance is very high. Third is the pancreatic beta cell has to produce insulin to convert our watermelon glucose into all the peripheral tissue. The capacity of the pancreatic beta cell to produce insulin is called insulin glucose index. This insulin glucose index is made out by a formula: fasting insulin minus 30 minutes of insulin divided by fasting glucose minus fasting glucose by 30 minutes glucose. Value is 0.4, cutoff point. Anything below that indicates that your pancreatic beta cell is unable to produce the insulin, required amount of insulin. Next is oral disposition index. That is, once you take the watermelon, our body should be ready to accept the glucose, and the insulin should be produced, and it should be shunted to the skeletal muscle and adipose tissue. Entire process called oral disposition index. Value is 1. If the cutoff point is below 1, it indicates you are not able to distribute your blood glucose. So the 5 points are, is not only the food, it is the human part that is most important. The lot of diet and the keto diets, Atkins diets, and everybody comes and tells a diet every day. They forget there is a human part to it. So it is not the food that triggers the diabetes, it is a human part to that, wherein if you can sleep for 8 hours, your pancreatic beta cell will be able to produce more amounts of insulin. The IgI index will be more than 0.4. So you'll be able to produce more amount of insulin. By walking 10,000 steps, your insulin sensitivity increases. So your body will be able to take more amount of insulin. This is what Matsuda index of 4. Then by taking of plant-based foods, you are able to accept more amount of glucose into it. Because of that, your total oral disposition index is more than 1. Because of all these factors, you taking 8 hours sleep and 10,000 steps, and 7 p.m. should be the last dinner. By giving intermittent fasting, you are preparing your body for all this process to happen very easily, and you are able to take a watermelon. So 1 kg of watermelon, even if your blood sugar is below 100, if the HOMA-IR is less than 2.3, and the oral disposition index is more than 1, your IgA, the insulin secreting capacity is more than 0.4, then the chance of getting a diabetes are very low. Thank you.